I keep meaning to update, but life gets in the way. There's been lots of stuff going on, not a lot of stuff going on. I'm going to keep this short today because I'm having stomach cramps, which isn't unusual these days for me. Um, yeah, I have to say the treatment for anal cancer is brutal. They don't exaggerate too much when they say that it's extraordinarily harsh treatment. But, I came through it okay. I think my last update was just after I'd had a negative reaction to the Zalota or the capecitabine. I'm not sure if that's being pronounced properly. I had a cardiotoxic reaction to it. So they actually stopped my chemo right up until the 5th week of chemo. Then I was given an infusion of a Raltitrexed. I will have to look that up and correct myself later. Um, with my mitomycin C. So I had a double infusion of chemo, no more pills, just one on the 5th week. And that went off okay. As okay as chemo can be. It was the treatment was not too bad up until week 5. There was itching and there was a little bit of discomfort, but week 5, along with the chemo, the radiation really started to kick in. The chemo is meant to make the radiation be more effective, so I think it worked on that level. I didn't have too much problems with bowel movements. A lot of people that go through the anal cancer treatment, and I'm assuming the rectal cancer as well, because they're very similar, experience, incontinence and all that lovely stuff that you don't want to talk about. I didn't have any of those problems. I did have diarrhea, I had some constipation, and the burning. The burning was not so bad going pee, but definitely having a bowel movement was something else, and particularly by week 6. Sitting was a little uncomfortable. I actually think that the worst part of the whole thing, though, was the absolute radical fatigue and the nausea. I had a lot of nausea in the last week and a half of the treatment, so that made eating anything totally unpleasant. Wasn't a happy camper. Didn't feel good at all at any point. Was able to sleep okay because of the pain meds. So that was definitely, and that was one thing I was doing. I was trying to manage the pain. They had me on medication that was adequate, not too high a dose. I'm pretty sensitive to that stuff. So, yeah, it was, it was survivable. It was interesting not being at home the whole time. The whole thing was kind of disorienting, but in a way, I think that I prefer that because when treatment ended and I came home, it was like going into another world. For reference, now I'm 9.5 weeks out, almost 9.5 weeks, 9 weeks, 2 days after treatment. So, I've been home for a while, but getting home was super nice. I used the cream the whole time during treatment. When I was getting the radiation, it was a silicone based cream. And I'll try and put the name of it in the remarks in case anybody's interested. The oncologist was impressed with how well my skin fared through the whole thing. I really didn't have a lot of blistering. The skin did darken and started peeling. But about a week and a half out, once I got home, the pain really started to ease up. And I could definitely tell things were feeling better. I was healing. I was able to go to the bathroom without trying to bite onto a shoe or something to stop myself from screaming, which that went on for about a week and a half after treatment, where it was just like, oh no, I don't want to go. I had a little bit of problems with going, like knowing when I had to go. So, being around a bathroom was really helpful, but I still didn't have any incontinence. And that was very good. Of course, I used Imodium, and I'm still using Imodium whenever I go. You can see my little Imodium box up behind me there near my painting of the crow. Um, and Yeah, so anytime that I'm going to go anywhere, I take a couple because I just don't know. It seems to be that things can come on quite suddenly, and particularly figuring out what you can eat without triggering any problems can be difficult. So anyway, I was managing with that, and so by week two, that part of it was, starting to feel pretty good. My bowel movements I have, as a result, I'm assuming, of the radiation, but it could be because of the tumor, and the fact that it's going away. I have a lack of nerve sensation down there. So although I can tell with my digestive system that I have to go, I don't necessarily know when I'm going how much I've gone or if anything's coming out. I mean, it's really odd, but the whole, and that might have helped me during the healing part of it, because maybe I would have had more pain if I hadn't had some nerve damage down there. And yeah. So, but one thing that did happen to me as I progressed through the healing was a increase in hip and pelvic pain. And I started feeling the pelvic and hip pain probably pretty quick, like week 3, week 4. It was becoming harder to walk as far as stiffness goes, and it was just all really achy down there. And so by the time that I came home and the anal pain was going away, the hip pain started increasing. And, by week 3 after treatment, it was to the point where I couldn't really walk up the stairs. I mean, I have a little bit of problems with the mobility anyway because of my spinal arthritis and all my other crap, but, you know, inconsequential crap compared to cancer. But this was like getting out of bed, everything, and my hips were just aching. I couldn't sleep. The painkillers weren't really helping. I finished all the meds that they'd given me, and so I phoned the oncologist and I said, I think I'm going to need more medication. My hips, I'm having excruciating pain in them. And so the oncologist said to me, well, rather than give you more painkillers, I think that the inflammation from the radiation might be causing the problem. So let's try you on some prednisone. And I have to say, I know a lot of people have negative side effects from prednisone, and it's probably not very good stuff, but oh my God, it was like losing 20 years of aging. I mean, after day 2, day 3 of the prednisone, I was walking like my old self again, like 3 years ago self. So yeah, that was amazing. I'm really glad I was able to taper down on my painkillers back to what I was taking prior to treatment. So I'm really happy with that. As far as things like hair loss, well, it's growing back in, but I did experience quite a bit of thinning. I used to have pretty thick hair. I don't really care. I'm not a big hair person. That's why I shaved it off before treatment, just in case I like lost clumps of it. Um, and I didn't lose clumps, but I mean they were like, the length of a cat hair, so who knows. I was definitely leaving some on the pillow, but the hair loss actually continued probably up until about a week ago. My hair has just been continually thinning and thinning, and yeah, there's no sign of it growing back yet, any of the stuff that I lost, but that's not a big deal. And I've got a really nice smooth Brazilian. I won't have to go see any, and I've been told that my lower pubic hair may never grow back. I lost all the hair in one of my armpits. The other one's fine. little bit of leg hair thinning and stuff like that. And ironically, maybe because of the chemo with the prednisone, they worry or they warn you about hair growing in places that you might not want it. But I haven't had any hair grow back anywhere, so I'm not particularly worried about that. And maybe I should take anything I can get. Doesn't really matter. I mean, I'll probably, if my hair doesn't come back in, because I know when my mom went through treatment for lung cancer, she had small cell lung cancer, and she went through treatment, chemo, lost all her hair, but she actually went into remission for several years. So she was really fortunate in that. But when her hair fell out with the first round of chemo, it never really grew back the same. She always had very thin hair after that, so she used a lot of hair products to try and thicken her hair. But I mean, I don't care. Hair is the least important thing. If I feel okay, that's what's important. And I mean, thanks to the prednisone, I'm on the taper down. So I had 2 weeks of like 80 milligrams of prednisone, and then 1 week of 60 milligrams of prednisone. I'm now on week 4, so it's I've tapered down to 40 milligrams of prednisone, and I'm still feeling pretty good. I can actually feel some of the pain though, and the aching coming back. It's definitely not anywhere near where it was, but I'm also noticing that that energy burst that I was enjoying is kind of going back down, and the fatigue is creeping in a little bit more. I'm really hoping I don't go right back to the beginning of the hip pain and the fatigue. The nausea completely resolved with the prednisone, which was really great, because I was like, after being home for 3 weeks and trying to figure out what I could eat, my diet, what I could do, the nausea was becoming probably one of the most frustrating points for me, because you don't feel like doing anything when you feel like throwing up all the time, like even in driving in a car. I mean, when I'm the driver, I don't usually get car sick, but I was getting car sick as the driver, because the nausea was just there all the time. And I had the anti-nauseas. I was taking the Zofran, or whatever it's called. I had another, Donsitron. I had another anti-nausea that they'd given me, a PRN, and or whatever they call it, the one that's supposed to work super quick. None of it was doing anything. The doctor that I have here at home had mentioned that perhaps the vagus nerve had been, irritated by the treatment, and that was responsible for the nausea, which would explain the fact that it wasn't responding to medication at all. But it did respond to the prednisone, so I've been eating like a horse, and which is really nice, because it's been, I don't know what, I started treatment on May 7th. Was it May? No, I ended treatment on May 7th, sorry. I started treatment on March 27th, and so, it was from March 27th until 3 weeks after I got home, I virtually had no appetite and was having a really hard time eating, because my stomach started getting irritated immediately once the chemo was in my system. And yeah, so it's kind of nice. There's a couple of points that worry me though. I'm been eating this 4 weeks now. My appetite has been stimulated by the prednisone, having a nightly bowl of Cheerios before I go to bed. And I still seem to be losing weight. I don't know if that is due to the treatment just still kind of screwing with my system. I mean, I do have to say my movements have returned closer to normal, actually more normal than they've been recently for the last year and a half. So, I mean, obviously the anal cancer was affecting my system. a little more than I was giving it credit for. But it's things move through me very quickly. So, and I'm not really digesting properly. I can tell that my system's still irritated, so that could be part of it. I had a meeting with the medical oncologist. So they did a CT with contrast. That was maybe 3 weeks ago now. Yeah, because I was 6 weeks out. And they had a meeting over the phone with the medical oncologist. And the medical oncologist was pleased with the way everything was looking. And so they turned the care over to basically, I won't be talking to her again until when, hopefully not, fingers crossed, knock on wood, all that stuff, if I ever have a reoccurrence or something like that. So now I'm just with the radiation oncologist. So the CT scan did show a reduction in the bulk of the tumor, which I was told was pretty good for the 6-week mark. However, on the CT with contrast, and not mentioned in any of the previous CTs, was a lung nodule, which doesn't necessarily make me feel great. And both the previous CT and this last one showed lesions on my liver. They are believed to be, according to the radiation oncologist, benign lesions on the liver. Supposedly everybody has them, but I've got multiple. So I'm not really feeling that great about that. I did ask a lot of questions. Didn't really get a reassuring feeling answer on that, and we will wait and see. There has been no increase in the size from the last CT, which happened at about 3-4 weeks during treatment, about halfway through treatment, and or a little over halfway, and 6 weeks. But that's really not a very long time for me to say, oh, yeah, great, they haven't grown at all. I mean, we're talking like 6 weeks or whatever, 6-7 weeks of time, 6 weeks out of treatment. So, I would hope that you wouldn't see any growth, even if it was cancer. That would be really quick. But we will see. I have a tumor on my benign, supposedly, tumor on my adrenal gland, on my left kidney. And I found out that I have moderate to severe emphysema. Sometimes you think maybe we shouldn't look as close as we are, because you find a lot of stuff you don't want to know about. But I mean, the emphysema explains the fatigue and stuff that I had before too. I mean, like all of it's just this parcel of growing old and falling apart. It's like I turned 50. I'm 53 now. And my body just decided to spontaneously combust. It started with the arthritis and frozen shoulder and all this stuff. Anyway, whatever. I don't even... That's like a different video channel. Old and falling apart. This one's about my journey with anal cancer. So that's where I am now. I mean, it's, we're just in a watch and wait. I have another oncologist appointment in person with an exam. Oh, yes, the exam. So I had an exam with my radiation oncologist on where are we now? I can't remember. Somewhere near the end of June. I think you'd think they gave me radiation to my brain. And she did a digital exam. That's always fun. I was actually really terrified about that, because I thought, well, this is probably going to hurt, because I've heard everybody gets stenosis and it all shrivels up down there. But actually, due to the nerve damage, and also too, the radiation oncologist said I've healed up really well. There really doesn't seem to be a lot of scar tissue or stenosis going on down there. The digital exam was painless. I mean, not pleasant, but you kind of, especially with anal cancer, you kind of lose all your dignity and get used to people putting on gloves and sticking fingers where you just really didn't want them. Anyway, so yeah, the digital exam went relatively painless, and my radiation oncologist said that she could no longer feel a solid mass down there. So, in other words, the tumor seems to have broken down, softened up, hopefully because it's dying, and she was super pleased with that. So, I still have to go see her every 3 months for the same type of exam. But she was saying that, at this point, she was really hopeful that that was a really positive sign and that I was going to be done with this cancer, possibly. But of course, way too early to say. They won't give me an NED or a "you're cured" stamp for, I believe, 3 years. So, yeah, we're not going to get too ahead of ourselves here. I know that the anal cancer reoccurrence within the first year is, a fairly high percentage. And so they don't like to say anything like that. And then, of course, if it does reoccur, it's straight to APR and a stoma and all that good stuff. So I've been told. I'm trying to be realistic about it. I mean, cancer is one of those things. I've had a lot of it in my family, my dad, my mom, my grandpa, and my other grandpa. And, you can't really let go of the idea that there's always this chance it's going to come back. And of course, with the radiation damage, there's always a chance that something else that was lurking in your system is going to become cancer. I have colon cancer in my family, my father, my grandfather, my uncle, and that's what I thought I had. So, that was why I was pushing for the colonoscopy. And when I started having bleeding during a bowel movement, I was like, oh, here we go. And when they found the anal cancer, they also at the same time removed 3 more polyps from my rectum. Now it's been 2 years since my previous colonoscopy, and at that time, you heard my cat, they removed several polyps. I can't remember how many. I'd have to look at the pathology report again. So, yeah. I mean, there's cancer in my family. There's quite a bit of cancer in my family, and there's definitely a hereditary component. So, I kind of feel like this is my first go at the rodeo. I'm not gonna get myself into the state of jumping around. I'm cancer free, and then have myself get whacked on the side of the head and fall down again. We take it one day at a time. Don't concentrate too much on what tomorrow brings. Don't sit there and think about my liver lesions or my lung nodule. And I just, try and move forward from here. I don't know. We'll see. All these appointments, they keep coming, and the one thing I didn't necessarily like was that when I asked the oncologist, because I thought at around 6 months I'd be getting another PET scan, she says a year. Well, we'll monitor my symptoms. I've had a couple of things. I don't know. Is it radiation? What is it? I've had aching in some of the lymph nodes along my groin in the last, I don't know, week and a half. It could just be the inflammation coming back. So, yeah. Anyway, you never really stop thinking about it, I guess. Mortality. It's a interesting place to be at in your life. I can't really think of anything else to say now. Yeah. I'm kind of tired, and I've got these stomach cramps going on. And it's just probably time for me to say goodbye for now. And I'll try and update sometime in the future. I'm doing this not just for someone who might have anal cancer that comes across this and wants to see what somebody else has dealt with and how it goes, but also for myself to be able to reflect on my feelings and how I fared through the whole thing. Maybe if I make it to be an old lady, to be able to take a look at my younger self and go, oh, look, I wasn't as funny looking as I thought I was. And, should the unthinkable happen someday, uh, my daughter, uh, any of my friends and family that want to come and see me talk about the bullshit I went through can use this as a kind of a place to come and say hi. So, anyway, I hope everybody out there is doing well, and I hope future me and future my daughter and everybody is happy, and it'd be really nice to go hiking again. That's what I got my sights set on. Get well enough to get out there and go pick some mushrooms this fall, and geez, that might be a fun video too. Take people along. Maybe I'll start painting again and finish that crow, or do something. I'll talk to you sometime soon. Bye bye.